That's one heroin case. And of course, we've told you about the connection between heroin and opioid addiction. Well, today, federal drug agents rolling out a strategy for tackling the problem.
It is a broad approach that includes partnering with a bunch of groups in the community, going beyond just law and order. New here at 6, WATE 6 on your side reporter Bridget Burelow looking into the DEA's 360 strategy.
The DEA making Knox County a priority in the fight against opioids, investing money and resources to education and prevention.
We want to make sure that Knox County gets the attention it needs where we can help.
The Drug Enforcement Agency rolling out a comprehensive approach to combat opioid and heroin abuse, partnering with a long list of Knoxville area organizations from local police, the district attorney's office, schools to hospitals.
One of the things is that we will bring in funding to help programs expand or be able to reach communities that they might not be able to reach.
The goal to steer people away from drugs from the start, help healthcare professionals and social service groups provide long-term help to those already addicted, and build drug-free communities that offer support. Here in Knox County, 300 people died from overdose deaths in 2017, with the area on track to surpass that number this year. It's a problem that's not only affecting families, but it's also changing the way first responders do their jobs.
One example is the increasing number of times our first responders have to administer naloxone to revive a person who has overdosed.
Another consequence of the opioid epidemic is what it's doing to children at birth.
NAS has been a growing problem in East Tennessee. Unfortunately, we're the epicenter of this neonatal abstinence syndrome crisis.
With drug-using moms bringing their newborns into the world addicted to drugs.
You really feel kind of helpless because these babies are experiencing this very similar symptoms to what adults experience, except these are innocent victims.
And though the DEA doesn't have all the answers, Special Agent Evans says coming together is the start to fixing the problem.
If we can prevent anybody from going down this path, that's the best thing for everybody.
All right. A worrisome statistic in light of all of this. Last year, 31% of all babies admitted to the NICU at East Tennessee Children's Hospital were dependent on medications at birth.
It's scary, frightening,
Yes.
and tragic. And of course, we'll keep you posted on this new strategy to combat all of this here in our area.